Today we are doing Sculptra, and Sculptra is Poly-L Lactic acid, and it is a bio-stimulatory filler. So it's gonna look like filler today, but in 3 or 4 days, it's not gonna look like anything was done. But then in about a month, our patient's gonna notice that her skin feels a little bit lifted. And then over the course of the next 3 months, she's gonna make collagen right where we put our Sculptra. And people are happy with Sculptra for over 25 months. So we love it. I do it, most of the staff does it, we love it. So we're going to do a typical treatment today for you on a lovely patient. All right, are you ready? Okay, so put your hip back for me. And I like to start at the temple, so we're gonna go 1, 2, 3, la, 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 la. Yeah, I know it's a little, here we go. So temples tend to make people look, you know, especially when you're skinny, we don't want our temples to be sunken in. So when we do sculpture in the temples, it helps even lift up the eyes. Okay, so I'm going to have you ice the top of the cheek. There we go. I'm gonna come up. Good. Okay.
Mm-hmm.
Okay. Now what we're gonna do is I want you to ice right down here. We're gonna come back to the cheek. We're gonna go in the opposite direction though, but not yet. And I like doing in front of the ear because it'll help to pull everything back in that direction too. So the whole key is to pull everything back, right?
Yes.
We're gonna fight gravity with everything we've got. Okay. Go. 1, 2, 3. Ay. La la la. Boom boom boom. You got it. You're doing so good. Okay, cool. You're doing great.
Mm-hmm.
A little bit there to help lift up there. Good. Ice here for me. And this helps pull up the chin a little bit. Good job. Now what we're gonna do is I'm gonna have you ice over here.
Mm-hmm.
Yep, right down there. Turn away from me. And so now this, I'm gonna go right here, 1, 2, 3, and I'm gonna put some just in this little area. I know it's not really a little area, it doesn't feel like a little area.
But that's where I need it.
But this is exactly where you need it.
Mm-hmm.
Now we're going to the other side, and we're gonna go back to the temple. Ready? 1, 2, 3. La, 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 la. You okay here?
Mm-hmm.
Good job. You got it. Let's see if I go a little bit lower. Okay, let's come up again. Okay. You doing okay?
Mm-hmm.
Okay, let's ice right there. And you know, like I said before, it takes about a month to start seeing results, and then 3 months is how long it takes somebody to make collagen. So 3 months after the last injection is when you're going to see the best results. 1, 2, 3. And then there'll be more and more and more and more to come as you'll keep making collagen. And like I said, people are happy with Sculptra for over 25 months, which is great. So that's 2 years. But I always tell people to come back in like 1 year and just do 1 or 2 vials. Like just keep it up. And typically people need 1 vial per decade of life. And usually people are always over 40 by the time they start Sculptra. So that's why we start with 4. 1, 2, 3. I know it feels good, right?
Mm-hmm.
Oh, so good. You got it.
It's not the worst thing.
We have to keep remembering that.
Just a little bit of pressure.
And then you're going to be numb because there's lidocaine in this.
Okay.
So you're going to be numb for about an hour to 2 hours.
Okay.
And again, you just have to be patient with the results because it's going to take a little bit of time.
I can't make my right eye.
Yeah, so I was going to tell you, sometimes people get a little twitchy in the eyes or they feel a little funny because of the lidocaine. That'll go away in about a minute.
Okay.
Yeah. So there's a couple other biostimulator injectables. One would be Radiesse, which is made of calcium hydroxylapatite, and it also is a filler that can look like a filler right away, but it can also be used as a collagen stimulator like this is. And then there's of course PRP and PRF, which also act as collagen stimulators. So it just depends on really kind of mood you're in, what kind of special there is, what you want to try. If you've tried Sculptra before and you want to try some Radiesse, they all work well together, but they're all very natural and slow going. So none of them are going to give you the quick filler look when you're doing the biostimulatory type of treatments. But really the risk of bruising is about it with Sculptra. So it does have kind of a reputation. For years ago, there were some issues with granulomas, and that occurred, they were like little knots under the skin, and that occurred because people were mixing it not with as much dilutant as we do now, and they weren't going as deep with it. So we changed the way we inject, and we changed the way we mix it, so that should not happen. And especially if you're doing the massage too, that helps prevent those. But other than that, I love Sculptra. I do Sculptra, I love it. I think I've said that 20 times. You will love it in another 3 months. If you don't already love it.
I like it so far after the first treatment.
Good. So yeah, and that brings up a good point. So typically the way I do it is 2 vials today and then 2 vials in 2 months. And so that's your 4 vials. If you were 60, I would tell you to come back and do 2 more vials in 2 more months. If you were 80, I would tell you to come back again and do 2 more vials in 2 more months from then. But once you do the 4 vials, or however many as your correction vials, then 1 to 2 vials a year, and that'll keep it going. So you can add to Sculptra, you can put fillers on top of Sculptra, you can put Sculptra on top of fillers. You can do laser treatments in addition to having Sculptra in there. It's not going to disrupt what's going on. So combination treatments are always key. But if you want to find out if Sculptra is right for you, or if you want to learn about any of our other over 55 procedures, you can find us online at RejuvenationMD.com.